Hello and welcome to Bristol Health Cares. I'm your host, Kurt Barwis. I am the president and CEO of Bristol Health. This program is for you. It's really about how you navigate the system of care, how you access care, and it's really about trying to answer questions you may have and really didn't know who to ask. We are going to bring to you professionals, doctors, surgeons, other healthcare professionals throughout our system of care, maybe people that you've never talked to before or met before, but the goal is to really help you understand how to access care when you need it. You're going to enjoy this program. This program is really for you. So what's important is if there is something that you want to learn about or know about or a guest that you'd like me to host on this show, write us and we'll try to make that happen for you. So enjoy the program, Bristol Health Cares. Hello and welcome to this episode of Bristol Health Cares. I am Kurt Barwis, your host and the president and CEO of Bristol Health. We have a very special episode today. And today we have Courtney Watson, who is the physician liaison at the hospital. Courtney, welcome to the show. Tell us a little bit about yourself.
Thank you for having me today. So my name is Courtney Watson. I'm the physician liaison at Bristol Health. I've been with Bristol Health for 5 years, and then in this role for about a year, actually, it's coming up. So it will be a year in June. Well, yeah.
Wow, 1 year.
Yeah.
So what was your role before physician liaison?
So I was the WIC nutritionist here in town for 5 years. It was a pleasure to serve the community in that capacity, and to be able to give back, and really help moms that might be in need, and also the babies of our community.
So your journey, so you're a nutritionist, and then you kind of flipped into this other role. So is your education and background all nutrition?
Yeah, so my first degree is in sports medicine, and then my second degree is in nutrition. But what I like about this role, it is more of a business role. So I'm learning so much every single day about having like a business mindset. So it's, yeah.
But it seems like, and tell me if I'm wrong, but you're connecting people with services, and you're still getting that kind of great feeling about doing good. Does that make sense?
Absolutely. For example, we had a meeting last week with some ENT doctors who are independent. And so if they were to help out here at Bristol Health, we would have ENT services. Yeah. And that's one of our highest wants here at Bristol Health. So, yeah. So I was able to go ahead and have that meeting, and hopefully we'll be able to bring those doctors on. So yeah, that way I'm helping the community, and it is, it's a great feeling. I'm grateful to be able to help out, especially because we need this service at our hospital.
Yeah, ENT has been on my bucket list of recruitment for a long time. So I wasn't aware of those conversations. That's really good news.
Yeah.
I've been trying to recruit ENT for a long, long time.
Yep.
So what's the scope of this role, physician liaison? Talk a little bit about that. I think people would probably be curious about what you do.
Yeah, it's a little bit what you were just explaining. It's really helping all of the providers to connect with other providers. And the importance of that is then to build up their referrals. And so the more referrals that a doctor can have, that's kind of more partnerships that they have, which ultimately helps to have like a comprehensive continuum of care for a patient. So that's the ultimate goal, right? We want the patient to be able to come to us and have all of the referrals that they would need in one little space.
Yeah, so I think that's really kind of one of the things that I really have focused on in my time is that people all talk about longing for the old days when doctors socialized with doctors at different places, and it was easy to pick up the phone and talk to them and collaborate on a patient. Now everything's electronic, and it's a whole different world. But I feel like what you just described is kind of part of the secret sauce of Bristol Health, because the doctors actually talk to each other and they share patients with each other. And I've seen them, literally in the medical center, get up and walk down the hallway when a patient's there presenting with maybe not a problem that's specific to their specialty, but they grab somebody else and bring them right in and collaborate. And for me, that just means incredibly good outcomes for the people that come to our medical center and for our community.
Yeah.
And it kind of goes into that access thing. So you described kind of the puzzle of what are the pieces of the puzzle we're missing. If we had ENT, we could do all these things. I just had Dr. Kumar on the show, and she was talking about a new procedure for sleep apnea, which ENT surgeons do. Mm-hmm. And so we're certified to oversee those patients and all that kind of stuff. But we need that one little piece of the puzzle to,
And
so
that's the beauty.
So talk about a little bit about the environment in which you work in, like, your day-to-day stuff. How does that work?
Yeah. So it's meetings with all of, I would say, leadership. So I have a marketing meeting, a standing meeting every single week on Thursday. And so that's kind of, we come together, and I feel like it's a room full of great minds. And we kind of try to foresee, like, okay, what is the best thing that we could do right now to help Bristol Health succeed in this area or this area? What would our community want? What would benefit our community in the best way? And I love it because we all come together and then talk about, okay, we can connect with this person, or I should do this, I should say this. And you're able to bounce off ideas off of one another, especially in pretty much all of my leadership meetings. So even onboarding new doctors, we have a new colorectal surgeon that will be starting in the summer. And it's so helpful to have these meetings to say, what's the bigger picture here? How can we go ahead and connect him with certain people, whether it be internally or externally, and what does his onboarding experience look like? Because we want the physicians to be happy, and our providers, but that first experience really sets the tone, I feel like, for their journey.
Yeah, that onboarding, the onboarding process is something that we have to pay a lot of attention to, because, like you said, that's their first impression. And I don't think, I mean, even myself, I never really comprehended how complex it is. I mean, these physicians have to go through licensure with the state. They have to get their DEA. They have to apply for privileges at the hospital. They have to apply for credentialing to every single insurance company that we take. And all of that has to be done along with what you just talked about too, which is, how do I introduce? So new colorectal surgeon's going to join our team. Yeah. Everybody's super, super excited about this. And what are the connection points? Who do we need to make sure that this person connects with? How do they get a hold of them? All of that stuff has to happen. And then the community itself, introducing that physician to the community, which is it's a big job that you have.
Yeah,
it's a really big job, making sure all those pieces are fit together, right?
It is a big job, yeah. And we also have a new podiatrist that's starting next week. So I'm really excited about kind of onboarding a new foot doctor.
Yeah.
So he manages all anything to do with the foot. But already having those conversations with him before he starts to kind of get him excited about joining our team. And so that's been in the works, and so it's kind of the behind the scenes, I guess you can say. And then just setting up his itinerary. So making sure his first week is as seamless as possible. And bouncing ideas off of our other podiatrist, Dr. John, and asking him, like, oh, who do you think he should meet with?
Yeah.
And so that was really helpful. It was, and it's certain things like that I continuously learn about. And so I'm putting those different pieces in, I guess, my toolbox. So I'm like, oh, it does make sense to reach out to the other providers, and also the practice managers and the practice directors as well, to ask, who should they meet? How should this flow work? So they can shadow different doctors and they continue to build those relationships throughout the whole entire week.
Yeah, it's and we also have a new orthopedic surgeon starting as well, right? So, and a local one coming from UConn, I think, and doing a fellowship somewhere, not that far away, I think.
Yeah, Dr. Labosky will be starting with us. He's already taking on call now, but he'll be starting within our clinic in the fall. No, August. Yes.
So then once the physician is onboarded in the initial period, you're not done. I mean, you're still connecting them with the community, like, for example, the senior center and stuff like that. So talk a little bit about that. I mean, how important is all that?
And that's that community aspect, and making sure that the community knows that we're onboarding these new doctors and these new providers. And so, and that's what's so great about Bristol Health is we have so many different specialty doctors. So it's just not primary care. It's all of the different specialties that you might not think we have. Like we have plastics. We have a plastic surgeon on staff. And so bringing, for example, her out to the community, not so much for the senior center, but for podiatry, more importantly, then working with your diabetes educator, I'll have Dr. Gennaro meet with the diabetes educator because people that have diabetes, they need to get their feet checked out frequently. Yeah. So, but then also bringing him to the senior center, which he'll be there in July. And so he's excited about that, and that's having that conversation before he even starts. There's this opportunity, and we're really excited to get you out into the community. So your load could be fulfilling, I guess, and satisfying, and you get to know our community. So.
Yeah, and the senior center is one of those things, but also we try to connect physicians to events that are in the community, like the Shamrock Run or other things that are happening. And I think that's such a great community service too, because somebody may have an issue or a problem and say, I'm not worried about it, I'll figure it out. But then you go to something like the business expo or something like that, and you meet one of these doctors and you just, oh, by the way, and the next thing you know, it makes a connection that helps that person solve whatever that problem is. So it's an extraordinary thing. So talk a little bit about, you talked about the teamness of your interactions with people throughout the system, but what do you think, if you kind of had to summarize what's the special thing about the physician group and, what makes it so unique? I mean, you talked about the diversity of, we have primary care, we have all the specialists, we're filling in some of the blank spots, but what makes them stay? It's you, right? It's the way you interact with them, Courtney.
It's you being our CEO, and I think also you're always available. And I think I hear that a lot within our community, within our physician and our providers community. We have a president that we can speak to at any given time. So I think that makes a huge difference. And you are always going above and beyond. And I think with leadership, it starts at the top. And it trickles down. You see it, I work with really closely with all of leadership, and everybody just works so hard. And, we may be really busy and we hold multiple hats, but the excellence, the level of putting your all into it every single day. My mentor, Tracy Brown, who's been with the company for a long time, many of years, she holds this level of, kindness, integrity. She goes above and beyond for anybody at our hospital. And when I noticed that, I really took to that, and I was like, okay, you're my mentor pretty much, because just how she works really hard, and she doesn't like when somebody's like having a bad day or can't figure something out. She'll put you in the right contact, all the time.
It's funny you mentioned her. I didn't realize that she was your mentor, which I think is awesome. I think she's great. I'm sure she's excellent at that. But when I go to my office in the morning, I turn the corner and her office is in the corner. Now, I never get to see her, but her door's open, and I always say, "Good morning, Tracy," even though we can't see each other, and I hear her say back, "Good morning, Kurt. How are you today?" So it's kind of really, it's an awesome part. There's a lot of people in my journey on the way in that I say hi to that I can't see, but I know they're in there. Renata is another one.
And that's the heart of our hospital, I feel like.
It is. It's and you know, for me personally, I feel like people should lead. Like, to me, I don't know that titles really matter. I think what matters is that if you create an environment for people to get to their highest potential, which includes happiness, that I want people to come to work happy every day. And because happy people make other people happy. Miserable people make everybody miserable. So so it is really important to me, and I'm just incredibly honored that every day I walk in, I still don't believe I actually do what I do. So so let's talk about your journey. You know, I don't know if you want to talk about this, but how did you end up coming to Bristol Health? I think this is kind of something that is really important to talk about.
Yeah.
If you feel comfortable talking about it.
My journey, I mean, I'm born and raised in Bristol, Connecticut, traveled off to college and, you know, kind of figured out that I still wanted to be within the medical field. I love helping people in that way. I really do, because you want somebody to be whole. I think our goal is to always make people whole, and that's why we do what we do. And it's a journey, you know, and sometimes it can be different pieces, you know, but the importance of it is that we are continuous to be there for somebody, you know, and just to help them to understand, you know, that it's a journey. And the important thing is just to be kind. You know, I think the biggest thing is really just to be helpful, to be kind, and to continue to show up. Those are like the biggest things. But my journey also started when I was a flight attendant. So I traveled the world.
You were a flight attendant. I didn't know. Okay, now there's something I didn't know.
Yep.
What airline were you with?
So it was a Republic Airways. So it was a small puddle jumper is what they call it, like a 50 passenger plane. And I had a couple of emergency landings, and I was like, this is not it. So I finished up my second degree, and then because I have a passion for nutrition, I do. And then I found this job for being a WIC nutritionist at Bristol Health, and it kind of all just fell into place. Sometimes that's how life happens. I think I had graduated that week, and the position had opened up that week. Yeah. But I had a small little voice had told me to actually start at Bristol Health. I have to backtrack a little bit because I actually started in the kitchen passing out trays.
Oh, I didn't know that either.
So that was my first job at Bristol Health. Darius had given me my job, my first job. And then I moved up, and that job, once I graduated, the WIC nutritionist job had opened up. I went there, and I stayed there. I was, you know, helping the community in that aspect. I was there throughout COVID, when the formula shortage was there as well. There's so many different programs that WIC does. We do the Thanksgiving Day baskets every single year. We also have the diaper collection as well. And so then I saw this position as well and wanted to kind of broaden my horizons, I guess you can say, and kind of get into that business mindset, you know, a little bit more, and just jumped.
So what do you, so I'm always curious about this, you know, and I mean, anybody asking this, but what's the long goal for you?
Right.
You see yourself sitting in my chair?
You do. I don't know about that. But possibly, you know, I think it's just continuing to help people out and also to be as happy as possible.
You know, I started as a patient transport. So I can tell you you know, I evolved in a hospital in the same kind of way for the same reasons that you just outlined. I loved people. I actually didn't know that I wanted to work in a hospital. My mom was a nurse. I wasn't working. She said, you need to get a job, go across the street, get a job at the hospital. Yeah. And the first job I didn't get. Actually, I interviewed for Central Sterile Supply, and that lady was not a nice lady. Went during the interview process, and I didn't get the job. And then I got a job as patient transport. And it's like you get sucked into, you just kind of become part of a family. And it doesn't matter what you do. You know, even as an accountant in a hospital, I got that feeling of I'm doing something good for the community that I live in. And but you ooze that out of you. It's just, you know, it's just, so please don't ever lose that. I mean, that's a passion. And look where I ended up. I mean, like, I never thought in a million years, in fact, I never, ever thought I would do this. But the family supports you, the people support you, the culture supports you, and people encourage you, you know, along the way. So don't ever lose it. I don't think, I always say this to people when they talk about dissatisfaction with what they're doing. I hate the work, I hate this. And I'm like, okay, then do something about it.
Right.
Don't just go to work and make everybody else miserable.
Exactly.
Go do something else.
Yeah.
And so how about on the education front? You think you're going to do anything more?
I would love to obtain my master's. Yeah, I think you know, just higher education, it's always a positive, you know. Yeah. So I could foresee myself. I'm not entirely sure yet. I do kind of miss counseling a little bit. I miss that one-to-one interaction with your patients. And once again, I love the idea of making somebody whole. So, exactly like what Dr. Kumar was saying. And that's, you know, she was talking about how nutrition and exercise is really important, but how sleep is the third pillar now that people are starting to recognize. And that's so important, you know, to make somebody whole, you know, and yeah.
Yeah, it's I love that, the way you describe that as making someone whole. And I am never really, maybe I probably haven't said it that way or processed that way, but it is a complete thought about, you know, what does it mean to be whole? It's not just physical.
No, yeah.
It's mental, it's attitude, it's family, it's all of those things that are so incredibly important to life, right? So Courtney, so how about, what do you want to tell the viewing audience about your role, about our organization, about these amazing physicians that you bring into our community? What's the most important thing you want to tell people, aside from you got to be whole, right?
Right. Our community hospital is the best community hospital. Our physicians are hardworking. Our physicians really do take time to give the best that they can. And we have awesome specialties as well, and primary care as well. So I believe that Bristol Health is the heart of health at Bristol, in Bristol, Connecticut. And yeah, it's the heart of health. I believe so. It just came to me this morning. I was saying to myself, I was like,
heart of health.
It's the heart of health in Bristol, Connecticut.
I love that.
It really is.
I love that. That's very catchy too. I think we'll have to work on that one.
Yeah.
But thank you for sharing that, and thank you for being here today.
Yeah.
It's really been a pleasure to get to know you better. And I didn't know you were an airline stewardess. I was on a plane where the engine caught on fire, and we were in the air for probably 30 minutes, and I heard the tape, and I can't believe what I heard after. They were talking about how many souls were on the plane, how much gas was on the plane. It was, so I completely understand how you feel. So anyway, this is Bristol Health, Bristol Health Cares. If you have questions or concerns, you know, and would love for me to cover an area or a topic, please email us at cares@bristolhospital.org. That's cares@bristolhospital.org. Special thank you to Nutmeg Studios for putting on this show. As I've said in every episode, this organization is extraordinary. They have an extraordinary team, capabilities. It's a nonprofit organization. We wouldn't have these programs without them. So please support them, be generous with them if you can. And until the next time, I'm looking forward to seeing you again. Have a wonderful day and be healthy. Signing off, Kurt Barwis.